All right, great. All right, hi everyone and welcome. Thank you for joining us today. My name is Cassandra and I am NAMI New York State's Communication and Youth Engagement Specialist. Each year, millions of Americans face the reality of living with a mental health condition. However, mental illness affects everyone directly or indirectly through family, friends, or coworkers. That's why this week, NAMI New York State is joining in raising awareness of mental illness. Last month was Suicide Prevention Awareness Month, a time where we focus on raising awareness on this stigmatized and often taboo topic. In addition to shifting public perception, we wanted to use today to spread hope and vital information to people affected by suicide. Our goal is ensuring that individuals, friends, and families have access to the resources they need to discuss suicide prevention and to seek help. So today we're joined by 3 panelist members, and we'll hear from the first one now. Gare, if you'd like to go ahead and introduce yourself.
Great, thank you so much. Welcome everyone. My name is Gare Lloyd-Lester. I work for the Suicide Prevention Center of New York State. My title is Coordinator of Community and Coalition Initiatives. So operationally, one of the things that means is I'm privileged and honored to work with a number of different local suicide prevention coalitions on the county level. Most counties in New York State have a coalition or a task force dedicated to addressing suicide on the county level. And so part of my job, part of my role is to help offer tools, resources, strategies, information to help that work on the local level, to provide a framework, to provide structure, and then really to get out of the way, because the work really happens on the local level, right? So that's a good portion of the work that I'm involved with. I'm also fortunate to be involved on the state level with partners in a few different areas related to suicide prevention. There's been quite a bit of work happening in the last few years on special populations that we know are at elevated risk and or impacted by suicide disproportionately across New York State. And so I've been fortunate to be involved with specifically work with first responders and veterans and active military. And so there's been some really exciting things that have occurred in that space over the last year plus. And I think fortunate that we've had the opportunity to do that work and make some progress, especially as it relates to the context, which has been COVID, right? So we've all had to make adjustments in terms of how we do what we do. A couple of things that I'd like to just highlight is in 2020, New York State committed to a federal initiative on preventing suicide amongst service members, veterans, and family. And they participated in what's referred to as the Governor's Challenge to prevent suicide amongst SMVF. And every state that participates in the Governor's Challenge focuses on 3 particular areas. One is transitioning service members, so going from active duty to civilian life. And we know that that's a very vulnerable time period for individuals, and that in many respects, there's not much opportunity in the way of planning and support and coordination. So that's one area of focus. Another area is identification and screening, right? We know that we need to be able to identify who are the veterans living and eating and working and playing in our communities, and then being able to offer opportunities to screen for the potential for suicide risk. So some really creative work is happening with New York State Department of Veterans Services and using the Columbia Brief Screener. And then the other area that I've been privileged to be leading the efforts on is lethal means safety as it relates to veterans. We know that the most lethal method of suicide in the United States is firearms, and veterans are disproportionately impacted by firearm suicides. And so we've been working with some content area experts to develop what right now we're calling the Family CALM model. CALM is a national program called Counseling Access on Lethal Means. And it's something that in many respects, clinicians will often access in terms of how to help support somebody who's identified thoughts of suicide, and to make sure that we put time and distance between those thoughts and the potential access to lethal means. But that tool is primarily for clinicians and professional caregivers. When we were doing an analysis of the work being done for veterans and lethal means, we realized that there really was not much in the way of tools and resources for family members and loved ones who have a veteran in their household and in their lives. Have a family member or loved one know to even begin to think about having a conversation around firearm safety and suicide? So we have been working with the developers of the CALM training through some funding by the New York State Health Foundation, and are going to have a website with some tools and resources and some video clips for family members that will be hopefully launched by the early part of 2022. And it's really, I think, in many respects, groundbreaking, because nothing like this exists. There's a lot of tools and resources for veterans and information and education and awareness on firearm safety and suicide prevention, but there has been a lack of knowledge and information for family members, for loved ones. So we're really excited about this, and we're being encouraged to also look at a second round of funding to enhance that work for some more targeted training. So that's some really exciting work happening in that particular space. If I'm okay on time, and feel free to give me a nudge if you need to. Some other things that are happening sort of statewide include, we have 2 federal grants addressing zero suicide. So zero suicide is not a program, but it is a framework, and it's looking at addressing suicide prevention specifically in healthcare. And so we've been doing some concentrated work in Onondaga County with healthcare providers over the last couple of years. And we also leveraged a Garrett Lee Smith Youth Suicide Prevention Grant. And so zero suicide funding typically addresses adults in healthcare settings. Garrett Lee Smith, as the title suggests, is looking at youth. So we envisioned what would it look like to translate the knowledge base around zero suicide for adults and apply those lessons to youth serving healthcare systems and organizations. And so we're doing that work in Onondaga County, which again is pretty innovative in terms of taking that adult model and working on it in Onondaga County, working not just with schools, but working with other youth serving organizations such as Liberty Resources and AIDS Community Resources and other entities. So we're really excited about that work and the promising outcomes of designing some manualized approaches to doing that work. We've also done, my partner and colleague, Pat Brew, has done amazing work with school systems over the past few years, is doing some incredible work with New York City Department of Education, rolling out some massive training opportunities and increasing the infrastructure, the capacity, not just in New York City, but you can imagine that New York City schools are the largest in the country, and she's making some significant impact on not just programming, but also on policy, which is really one of the key areas that we want to look at doing some work in. And the last thing that I'll mention right now is we're in the process of finishing up a grant targeting 4 counties on suicide fatality review teams. And so that's taking a look at what are the circumstances involved with individuals that have died by suicide, bringing together a team on the local level to explore those circumstances, looking at unique risk and protective factors. This was a model developed out of Washington County in Oregon by a medical death investigator and Dr. Kimberly Repp. And when she did that work in Oregon, for example, they found that a number of people dying by suicide were dropping off their pets at animal shelters in a couple of weeks prior to completing suicide. And so that allowed for some really targeted prevention strategies, right? Working and training those animal shelter employees. So we've had a grant for the last 3 years in Erie County, Onondaga County, Westchester, and Suffolk County. And we're excited to beginning to see some of that work unfold and bear some possible impact within those respective communities, with a hope of potentially eventually being able to replicate that. That's always the challenge in this work, is scaling the efforts up, right? But some promising practices. The last thing I want to note is that in relation to Suicide Prevention Month, WNYT, an NBC affiliate in the Capital Region, reached out to us and wanted to do something for Suicide Prevention Awareness Month. And so we were very fortunate to bring together 5 individuals who shared their stories as either attempt survivors or loss survivors or both. And we were hopeful that we could get a few minutes of airtime for this conversation, but the person from WNYT who was working with us advocated with her bosses to air the entire hour, which they did last week, and they're going to be airing it again on a sister station. I'm going to put that in from the link in the chat for folks to see in case you don't get a chance to view it in real time. But it just is an amazing testament to the idea that suicide prevention is everybody's business. And operationally, that means that we can all play a role in helping support someone who might be experiencing thoughts of suicide. And that show, and as you introduced it, is all about hope, right? I wish I could say that we could prevent life from throwing us speed curveballs once in a while, or a speed bump. That's probably not going to happen. But if we can listen to stories of hope and wellness and resilience, right, and what works for me and what works for you, then I think we're ultimately going to be able to make an impact for somebody who might be struggling in the moment. So I'll stop at that point and post that in the chat. But thank you all for being here.
Thank you so much, Kara, for sharing all that. And I would just like to thank you personally. I have 2 brothers. I have a lot of family members in the military, and I have 2 brothers who are active now. So it's great to know that this work is being done for sure. And Wendy, who's on somewhere, she's a vet herself. So I know she's very grateful, and I'm sure many of us are. You touch on so many different topics. I don't even know which one to really acknowledge here, but yeah, it sounds like, doing really great work. And I hope everyone who's interested will reach out to you to learn more. And I'm glad that you're going to be sharing that link with us today. Suicide, it was really interesting, the suicide prevention strategy that they're doing in Oregon that you mentioned with the pets. And, it's great that people are looking out of the box of thinking of how we can find different strategies to, make sure we're supporting those who are showing signs. And I have a few questions, but I think we'll let everyone speak. And then at the end, I'll ask a few more questions, some general questions, and then our panelists can answer. And then what we'll do is, if anyone has any questions, please put it in the chat. So now we will have Kara. Let me find Kara, who's going to share her story of resilience. So Kara, if you'd like to introduce yourself.
My name is Kara Golacki. I am a board member, upstate, or a Capital Region, board member and volunteer for NAMI. And I'll get right into my story. So 15 years ago, I went into the hospital due to a traumatic life event coupled with major depression, generalized anxiety, and OCD. While hospitalized, I was receiving phone calls which worsened my loss and deepened my pain. This pain grew to be unbearable, so much so I wanted it to end. It felt like it had become too painful to exist. I came up with a plan and followed it almost all the way through, but had a moment of clarity. I left behind a notebook, explaining to my loved ones it was not their fault. The pain was too much to bear. However, when I looked to my notebook, I noticed a towel was covering it and began to obsess and worry that it would be lost forever and no one would understand how I truly felt. In those brief moments, I realized what had happened to me was not worth my life, but I was physically trapped in the plan I had come up with. I patiently waited for nurses to arrive. Even though I changed my mind, I almost died that day, or certainly would have seriously injured myself. When the nurses arrived, they realized what was happening, and I will never forget the sound in their voices. That day and the following 3 weeks in constant observation, I knew my moment of clarity changed my life forever. It started with apologizing to the nurses and staff because I will never forget the sound of pain in their voices when they were calling out for additional help. I had to go through this painful experience and I learned I could survive. I learned my pain wouldn't last forever, and I haven't attempted suicide since. At times, I can't believe I would have wanted to end my life. For me, this is how I know depression is real and it lies to me. I believe there are more people out there just like me who found their few extra minutes and changed their minds. And I tell my story with hope that other people will find their few extra minutes and choose to live. Thank you.
Thank you so much, Kara. It's so important to share these stories. And I know anyone who's felt something similar can really appreciate the strength you showed today in sharing that.
Thank you.
Thank you. All right. And we have some comments in the chat that you're so brave and that was really impactful. And thank you so much for sharing and your courage and strength and hope. You know, a great example of someone who struggled and has come back and has done so much great work for her community. So thank you so much, Kara.
Thank you.
All right, great. And now we're going to go over to our next panelist speaker, Dan, if you're ready.
Yeah, hey, thanks for having me, Cass. Hopefully everybody can hear me okay. Before I start, I just wanted to say thank you for Kara for sharing her story. I know how difficult that can be, but it's so impactful, and the world is so much a better place for having you in it. I'm here wearing several different hats, so we'll go through them, cover them a little bit. I am currently serving as the board chair for the Capital Region chapter of the American Foundation for Suicide Prevention. I'm also lucky enough that I sit on our National Loss and Healing Council that really focuses on what we do for survivors of suicide loss. So that's one of the things that's very important to me. I ultimately come by this work because 31 years ago, when I was a freshman in college and 5 days after my 19th birthday, my father died by suicide. And I tell people to say I dealt with it poorly at the time would kind of to give you the impression I dealt with it at all. At the time, it was much easier just to suppress it, kind of go through life like in a state of just denial, really, and numbness. Way at college, dad was just a voice on the phone, easy enough to kind of go through the paces, put on this tough face, act like you're strong and that you have everything handled. My stepmother at the time made appointments for me to go see counselors, and I just kind of blew them off. I felt like somehow I could do it all on my own, and that was what it meant to be strong. Took more than a decade until I actually.
Hey, Kathy, this is Bill Dixon calling. It is Wednesday afternoon at about 12:20.
Went through my own period of work-related stress and anxiety. It was for about a 3 to 6 month period, was nearly debilitating. It little different than dealing with depression for me. It wasn't that I was in a suicidal ideation, but I was just convinced I was not going to survive. I went to the emergency room probably over a dozen times in a period of a month, just heart racing, palpitations, couldn't control everything. Eventually through that, finally sought counseling, got the help I needed, dealt with some of the unresolved issues surrounding my father's suicide, was able to finally come to terms with some of the anger I was carrying inside and some of the other emotions. Then fast forward another decade plus, I felt like I had reached a point where my journey could help other people travel an easier road and know that they're not alone in this and that there are people who care and people who understand. So I found AFSP, been volunteering with them for the past 14 years in various roles, lucky enough to be our board chair now. And one of my big focuses on the local level is building coalitions like Gara talked about and working with you guys and trying to, I know Matt very well and working together because as groups, we're stronger together than we are. I know we all play in the same sandbox, but when we work together, we can accomplish so much more. There's still, things have gotten better, but there's still a huge stigma about suicide and suicide prevention. And one of the things is even just saying suicide prevention to folks When you say that word, and I've even had it come up in a meeting here with people who work in the mental health field, one of the first things that comes to mind is someone in crisis, someone who needs the hotline, who needs immediate attention. And obviously we're always going to be there for those folks. But when you talk about other health issues, like if I say cancer prevention, now we're moving back to doing screenings when we're healthy, doing our self checks at home, having a plan in place to have our annual physical and our checkups. And in my mind, we really need to move this conversation back to that point, to where we're normalizing our mental health care, to where we're not waiting till the crisis occurs to address it. Most of us begin our physical health journey before we're even born. Our mothers are getting checks, we're getting taken care of, but we don't start our mental health journey until maybe in our teens if we experience a crisis, and for some of us way later. And it's kind of finding that balance to where we start talking about it, so that when you do reach a crisis level or have an event that could cause that, you have a plan in place and you understand what could trigger it. I kind of liken it to, if you're waiting for a mental health crisis to begin your mental health journey, it's kind of like buying fire extinguishers while your house is burning. We need to put those preventive actions in place that we talk about with other causes. One of the other great things with AFSP, heartbreaking but great, is we do a lot of work with survivors of suicide loss. And I'm lucky enough to be a part of some of those programs that we offer, where we can have intimate conversations, one-on-one or two on small groups with someone who shared a similar loss, so that you understand you're not alone. And I'd love to thank Gara for allowing me to be part of the show that was on WNYT. It was so amazing, and so many thanks to all the people who were involved with that.
Thank you, Dan. And now we'll go to questions. If anyone has any questions for our panelists about anything, this is your time. I have a few questions. Just give me a second to find Gara. All right. So I think a common question that many people have is, what can you do if you suspect someone may be having thoughts of suicide? So if any of you would like to try to answer that one.
I actually years ago had a friend who was in crisis reach out to me, because he knew what I had been through. And I think one of the biggest things you can do is be open and honest, be willing to ask them directly, are you thinking about suicide? You're not going to put that thought in their head. The friend in question literally was like, yeah, it's something I think about. It's like my to-do list for the day. And I just never make it to that step. So in that case, I stayed with him, got him to agree to get help, to find a counselor. At the point I left him, he had agreed that he would see the next day and he would make some calls and I would check back in. And it's kind of, getting that agreement, getting that commitment from them to see another sunrise.
Yeah, that's so important. I think, part of that is also trust your intuition, trust your gut, right? If you're in interaction with somebody and you're worried, maybe those worries are connected to suicide, maybe they're not, but it starts with you just noticing something going on with that person. And so never underestimate the impact that you can have on another person's life simply by being human, being genuine, and checking in. How many times do we walk down the hallway and, hey, how are you doing today, Dan? I'm 10 steps beyond Dan before I even get an answer, right? Because what's the expected answer? Oh, I'm fine, right? And if it's anything other than fine, sometimes we cringe like, oh, what do we do now, right? But, simply being willing to take an interest. And I know we've got spinning plates and a lot of different responsibilities as adults, but, simply by showing an interest in others and being able to check in with folks, even well before somebody might get to the level where suicide's become an option or it's more of an option. I think to me that's part of suicide prevention too. It's having those conversations, letting people know that you're comfortable having a conversation about suicide, right? And I think that is so important. And letting people know, especially for family members and loved ones, that you might have your own limits and boundaries of what you can do, right? That you can't just fall on one person's shoulders. It's so important to get other people involved. And ask that person, if they have acknowledged thoughts of suicide, who would they like to try to connect with? What would be helpful for them, right? Helping somebody with thoughts of suicide shouldn't be something we do to someone. It should be something we do with someone.
I'd like to add a little bit to that.
Yeah, good.
In my experience with two friends of mine, one survived and one did not, and the thing that they both had in common was alcohol and drug use. And when I reached out to like a 1-800 number for advice, they said, you're dealing with an addiction on top of something. So it was hard to, and from my experience with this person, it was hard to get through to that person, because I think if they weren't doing drugs to suppress the pain, maybe I could have reached them. So I don't know if anybody has any experience in that regard, as far as there being a dual diagnosis there.
Right, with dual diagnosis, things are always a little more complicated, but we just have to look for different ways to get collective help in different ways, and make sure that we have a team of people, right? Like I said, it doesn't just fall on one person's shoulders. If we have a whole body, if we're sick, we're not going to go see the eye doctor for our stomach pain, right? We need everyone for everything to help us out, and that's how we should look at our mental health. And that's okay with the different parts of it. If we need a little extra help, right? If we see our therapist, and then we see our psychiatrist, whoever we need to see, whoever we need to help us in our recovery, and any kind of recovery is really important. And I just wanted to mention something I really liked that Gareth said. You said, we have to ask what would help you. I think that's such an important question to ask someone, instead of trying to fix someone and looking at it in that way of, someone is in crisis, I need to do something to fix them right now. This is all on me. It's really hard to see someone you love suffering, but really to take a moment and say, hey, what do you need, can really make a difference in someone who is experiencing these thoughts. And so going into my next question, you mentioned, Gara, as well, intuition. What are some signs, if anyone can share some signs we should consider that would make us aware of someone we love might be considering suicide?
Some of the basic warning signs are mood changes. If it's an outgoing person, suddenly they're quiet, and sometimes vice versa. Sometimes when someone has made a decision and made a plan, they suddenly seem like they've taken a turn for the better, so to speak. So it is noticing those things, noticing if there is an increase in alcohol or drug use, if you're available for that, and just, talking to them.
I think oftentimes too, something that can be embedded with somebody who might get to the point where suicide becomes an option is any kind of loss. And so oftentimes we might think, loss of a loved one, loss of job, but really it can be loss of, and fill in the blank. So for many individuals, right, what's a loss for somebody else might not have the same impact for me, but someone else, it could be devastating. And so, building on what Dan said, has somebody experienced a recent loss or series of losses, and how is that impacting them? And is it something that might be cumulative in nature? And if they have other life stressors going on and other things going on, in their world, is that something that has perhaps made suicide an option? And I think it's really important for folks to know too that, and Carrie, you said this, I think so beautifully, is that, the vast majority of people struggling with current thoughts of suicide, it's not that they want to die, it's that they don't know how to go on living at that particular moment with whatever psychic and emotional pain they're feeling. And so, sort of understanding that is oftentimes part of the thought process. So it's not like trying to fix or resolve everything in the moment, but it's just, again, being genuine and authentic and being present. I think the other thing that we talk about as it relates to warning signs are just in general, are there changes in that person? Are there things that seem out of character for that individual that might cause us to be concerned, right? And that's what prompts the potential for dialogue.
Right, and someone in the comments said isolation and giving away things. Right? So the example of someone bringing their dog to a shelter, giving away things, they still care about their dog. They want to make sure they're safe, but they're giving away things they normally wouldn't do. So looking at that, giving away money, buying really lavish gifts sometimes can be a sign. I know someone close to me was spending every check, and we had to sit down and have a conversation and say, hey, you need this for yourself. So what's going on? Making sure you're asking the questions. And if you notice something and if you feel something, right, that, you're paying attention to those little warning signs you get. Let's see if there's any other questions that popped up here. Okay, so no. So my next question is, how can you support someone who has experienced loss by suicide?
I can talk to that too. I think for me, the biggest thing was if people were just there. There's still a huge stigma about it, and people kind of don't want to talk about the loss. It's letting them know they're not alone, that there are people who understand. For me, it was hard. People didn't want to talk about my dad. It's like, well, I just want to remember the person he was. So respecting the person that they were, and understanding that's still someone important and valid, and they're not less than because of the way they died. So one of the big things we focus on is that, you're not alone. There are folks who understand. There's support groups. I know NAMI has support groups. We have some survivor of suicide loss support groups in the area as well. And just really focusing on that togetherness. And yeah, I tell people, I don't necessarily say my dad died by suicide. I say he lost his battle with depression, because people at times don't see that fight side of it. They just see the sudden end, and they miss out on the fact that this person, just like someone who died from cancer, fought a fight, and at the end of the day, they just lost it.
Yeah, and thinking about, maybe they don't want to ask about maybe it's a family member, a loved one, that it's taboo to bring up their name again, but remembering that everyone is still a blessing in memory, and we, as someone who is, missing that person and still love them, it's nice to be able to talk about them, bring them to life in that way and keep them alive. So thank you for sharing that. Let's see, any other questions we got in the chat?
And just to build off that, I've had privilege and honor of knowing many individuals who identify as loss survivors, and they said that same thing. In essence, they don't want their loved one to be remembered by the way they died, but how they lived. They had a life they lived prior to dying by suicide, and so I've had a number of individuals say that they really cherish when somebody has a memory about their loved one that they may never have heard before, right? And obviously that can be awkward, and so I think again it comes back to asking the person, like, what was your loved one's name? Can I, I have a story, or whatever it might be. And I think in many instances people are grateful, as a way to honor and remember that person's the life that they lived, right?
Well, I'd like to add to Dan and Dara by saying that education on suicide is so important, because I've heard numerous times that it's an act of selfishness, when really it's an act of desperation and despair. It's not, I don't, I've heard it many times said that it's, the person was so selfish. It's not that at all. It's just wanting that pain to go away. And if there was more support, then you could express that pain to people without the stigma attached to it. And not have to go to that extreme for the support that you need to get through it. Because I believe you can get through it. An example of that. So.
Great, thank you. Thank you all. Now, next up, I'm going to introduce my colleague, Matt, who's going to share a project about how you can remember the people that we've lost, Remembrance Garden. So Matt, if you want to go ahead and introduce yourself.
Sure, thank you, Cass. I'm Matthew Shapiro. I think most of you might probably know me. I'm the Associate Director of Public Affairs for NAMI New York State, and it's really an honor to be a part of this conversation and to join really my good friends Gara and Dan, who are doing such amazing work on this. And as reference, this is something where NAMI New York State really wants to make a difference, both in preventing suicide as well as supporting those who have lost a loved one to suicide and raise awareness. So a couple of the things that we're doing, we're looking to reintroduce Nicole's Law, which was a bill that we introduced in 2019 before the pandemic hit, that would really reform hospital practices for people who have what we have called a self-inflicted life-threatening injury. So that could be a suicide attempt, a drug overdose, or an incident of self-harm, because sometimes it can be difficult to differentiate between what it actually was. For instance, in my family's case, we had twice have had an incident with my mom that ended up with her in the hospital, where we're not sure exactly if it was tried to take too much of her medication or it was a real suicide attempt, but both times it landed in the hospital, landed her in the hospital. And, she would have been flagged for Nicole's Law to get better treatment and better discharge. And that's really what we want to do is ensure that people coming out of the hospital after one of these incidents in that very vulnerable time get immediately connected with community services. Ideally, we would want them to get that appointment within 2 weeks of the discharge, because we know they need the services right away. What we hope to do is the same way as when someone has an assisted outpatient treatment order placed on them, they go to the head of the proverbial line for services. That would be the same thing that would happen with somebody coming out under Nicole's Law. They wouldn't have forced treatment, it would all be voluntary, but they would get that benefit of being a priority and going to the front of the line. So that's something we're very excited to be working on again. I think we're going to be doing some advocacy work with the American Foundation for Suicide Prevention and Dan and Sandra. And it's something we're very excited about to partner with you guys and really make our voices heard on this very important issue. Something else that we're working on that we're very proud of that I think checks a couple of the boxes that we've talked about is, the same family, Roy and Lucille Ater, who lost their daughter Nicole to suicide and were the ones who kind of worked with us to come up with the Nicole's Law, also have a new initiative that we've started. In just a couple weeks ago, we had our first dedication in Putnam County of it's the Nicole Ater Garden of Remembrance, which really does a couple of things. It gives families and friends and people who knew the person who was lost to suicide a place outside of a cemetery to remember them, a garden where there's benches. It's a warmer environment. A lot of people aren't comfortable going to a cemetery. So this is a public space. The one in Putnam has a plaque with several names of people who have been lost to suicide. You know, it was interesting, Dan talked about the stigma earlier that still exists. And, you know, we know there are many more. We worked with the AFSP chapter down there, and they talked to a lot of families who they know had lost someone, and they didn't want the names on the plaque yet. So it does show that there is still that stigma there, and hopefully this will really, you know, chip away at that stigma and show that there's no shame in what happened to these people. And you know, as Gareth said, this is not a judgmental thing. They were in so much pain, they couldn't take the pain anymore, as you so beautifully said, Kara, and talking to her and explaining your story. So we hope that this will help regulate the conversation, and inspire other families to do these as well. And we're also putting them in very public places. The one in Putnam County is right in the Putnam County office building, right as you walk into the front door, it's right to the left. So, you know, anyone who's coming into the Putnam County office to pay a bill or any other business they might have at Putnam County, they're going to walk by the Remembrance Garden right there. And hopefully our hope is that they'll stop, reflect on what this means, and you know, help dedicate themselves to more understanding about suicide prevention and not being afraid to touch on that topic, as Dan said, and Cass, you spoke so eloquently about too. You know, I think people are very hesitant to talk about this. They feel like they're gonna say something wrong or something like that. But again, we really hope this is gonna normalize that conversation. And most importantly, we want to see this. This was our first one that we dedicated a couple of weeks ago. We want to see one in at least every county in New York. That's really our goal, is to create these memorial gardens and public spaces throughout New York State. So all communities have this place to reflect, to gain some awareness about suicide, and hopefully change minds and hearts. And I know we still have a couple minutes, Cass, if you wanted to make me the co-host. We do have a really good news story from Channel 12 News in Westchester about the dedication of the garden that shows, you know, shows the Atares and everything they've been through. So I'm gonna share my screen and share the sound so we can just watch this really quick news video, and then I can certainly, any questions that people have, we can do that too. So share sound, make sure I did that. Alrighty.
Is paying tribute to those who have died by suicide in our region.
Yeah, News 12's Nadia Galindo shows us the memorial and what advocates are hoping to accomplish.
When I die, give what's left of me away.
Their loved one may have died alone.
And if you need to cry, cry for your brother.
But in death, the parents of Nicole Atier have found a way to bring people together.
This beautiful garden was created in loving memory of all those in Putnam County who died by suicide.
Lucille and Roy Atier spearheaded this first-of-its-kind garden of remembrance that recognizes lives lost to suicide. It now rests outside of the Putnam County office building in Carmel, conspicuously placed there for a reason.
It is a stigma.
Stigma attached to suicide stands as a barrier to people and families impacted by suicide.
This garden's purpose is to be a place of remembrance. It is also a powerful instrument of awareness that will hopefully generate much needed conversations about suicide prevention.
September marks Suicide Prevention Awareness Month. Advocates want to see the state do more on this issue. That's why they're encouraging state lawmakers to pass a bill next legislative session to create Nicole's Law. The bill, named after Nicole Atier, would create a red flag system for those hospitalized after attempting suicide and connect them and their families with resources.
Mental health issues, substance use disorder issues are no different than diabetes and heart disease. The only difference is that society has given them a negative connotation.
The Atiers hope more remembrance gardens will be planted across the state.
Love doesn't die, people do. So when all that's left of me is love, give me away.
They know all too well what's at stake. In Carmel, Nadia Galindo, News 12.
Now, if you or someone you know does need help, please call the National Suicide Prevention Lifeline. That's at 800-273-8255.
So it's really a remarkable thing that the Ateras have been able to do there. And we do want to, as you know, I said in my remarks that they were hoping not just to dedicate a garden here, but plant a seed that will grow throughout the state. And I think one of the other important takeaways from this is, you know, I worked with that reporter for a couple of days leading up to that story, and she had told me about some of the work she had done in raising awareness about suicide in veterans. And I was able to see that she was coming from this, from the correct angle and from the appropriate angle. And it's really encouraging to see that little shift in media. You know, Gary, you talked about the WATC program that you and Dan took part in, the fact that, you know, they would take an hour from, you know, and again, it originally aired from 7 to 8, which is like pre-prime time. It's not like this is something on at 6 in the morning where hardly anyone sees. I mean, this was, you know, 7 to 8. This is, you know, post-dinner, pre-prime time to dedicate and really have a very healthy discussion on this. You know, we really need to keep, you know, the media check on that and make sure they are, you know, reporting about this in a responsible way and normalizing the conversation. So good stuff all around with that. If people have any questions about the memorial gardens, or we are taking donations to help establish those in counties throughout the state, you can reach out to me about that, or about Nicole's Law, or any of our advocacy issues as well. And just one other quick plug. Well, and before I get to my plug, that at the end of that news piece that he gave the Suicide Prevention Lifeline, one thing that we are very excited about as a whole in New York is that number is going to get shortened to 988, which I think will help things and certainly help create a more appropriate mental health response to a mental health crisis, and hopefully will help prevent suicide as well. So that's something that's very encouraging. And finally, my last plug is that on October 22nd and 23rd, we are having our annual education conference. It's going to be virtual this year. We always have a session or sessions. In the past, we've actually had a whole track on zero suicide. Obviously, being virtual, everything's a little more streamlined. But this year's presentation, I think we kind of touched on it earlier when I talked about what we want to do with Nicole's Law, is recognizing, how do you recognize the difference between someone who's self-harming themselves and someone making a suicide attempt? Bill asked what the specifics of Nicole's Law are. Do I have a minute to answer that? I see it in the chat. Okay. So thank you, Bill. And I can kind of talk offline with you about that because there are a lot of specifics in we're actually in the process of changing the bill a little bit. You know, COVID impacted it somewhat, but basically what Nicole's Law would do, like I said, I think the most important element of it right now is to connect people to improve discharge planning coming out of the hospital. You know, in the Ater story with Nicole, she had made 5 suicide attempts in a 6-month period. And each time they felt like the discharge from the hospital wasn't appropriate, including one time when she was discharged into the streets of New York, still wearing the hospital slippers on her feet, and no plan, no resources, no family engagement. So that's the type of thing we want to improve. We want to make sure there is a designated discharge plan for these vulnerable people, that family insight is included in as a part of the recovery practice, and that family members, loved ones, and friends also get resources that they would need to care for someone during this very vulnerable time. One of the other things too is that there was a study a few years ago from Brown University, Garen might be familiar with this, where they studied practices for people coming out of emergency rooms who had made a suicide attempt. And one thing that they thought was, or that they found to be very helpful, was sending just a little message, a little postcard within that 2 weeks after the discharge, just letting them know people are thinking about them. We're behind you. You're not alone. All those messages. So that's something that we'd want too, as part of the discharge plan, sending, some notes and encouragement to people during that period. So in a nutshell, that's really what we're looking to do there, Bill. So thanks for that good question.
It's so powerful, that particular piece. I mean, who'd have thought in this day of everything being electronic, that sending a postcard, something that's tangible, right, that you get in the mail and says, hey, you were here, we're thinking about you, how you doing, right? Not, and so low cost, but the research suggests it has a significant or can have a significant impact on rehospitalization and on engaging with treatment going forward. It's, suicide
Handwritten.
be complicated.
Yeah,
Handwritten.
absolutely. Yeah.
Sorry, were you going to say something, Dan?
I was just going to agree with Gara that, yeah, that human touch, you can never overstate how much of an impact it can have on someone.
It needs to be a handwritten postcard, not a automated one.
Yeah, great point. Great point. Thank you, Bill, for adding that. All right. So I just want to thank you all again for joining us today for this vital conversation. And to remind everyone that it's Mental Illness Awareness Week, that we were having programs all week long, and that you can watch our journaling program on our social media pages. It'll be in tomorrow's e-newsletter. If you haven't, please subscribe. We also did a baking segment, Baking for Mental Health, that you can watch and learn how to make some comforting brownies. Tomorrow we have, tomorrow we have yoga. So if you want to do some mental and physical wellness going, you can start. If you've never tried it before, it's a great program. So please feel encouraged to do that. And Matt?
I just saw that last comment that somebody wrote about loneliness and dealing with loneliness. I do want to say, going back to plug the conference, that we do have a session on our wellness track featuring Dr. George Bonanno, who's one of the national experts on coping mechanisms. So he's going to be presenting. We also have another panel specifically talking about how to cope with the implications of loneliness and social isolation. So it is something we are very concerned about at NAMI, and it's going to be a big part of the discussion at our conference this year. And you can go to our website to learn more.
So make sure you sign up and register for the conference. And if you can find that in our e-newsletter as well tomorrow. And again, maybe do a little bit of self-care today. And just for everyone, please know that I'll stay on the line if anyone needs to talk after. I know we talked about we had a serious discussion and some heavy topics. So if anyone needs some services or connects to services, please just let me know. I'll stay on for a few minutes, but we are done with the program. Thank you all so much and have a great week.
Thanks, Cass. Great job.
Thank you.
Thank you, everyone.
Thank you, everyone.